Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Myxedema Coma. Myxedema Coma is a rare but life-threatening condition that can occur in severe cases of untreated or inadequately treated hypothyroidism. What is hypothyroidism? Hypothyroidism is a disorder in which thyroid gland does not produce enough thyroid hormones like T3, T4, leading to a slowdown of various body function because thyroid hormone has very essential role in metabolism, growth. So it leads to a slowdown of various bodily function. Like there will be bradycardia, there will be constipation, there will be lethargy. Myxedema coma is the most severe form of hypothyroidism, and it typically occurs when there is a significant decline in thyroid function. When thyroid function does not occur, or low function or no function in a person who is already hypothyroid, then will get myxedema coma. So it is a severe form of hypothyroidism that occurs rarely. The condition is more common in older adults, particularly in women. Ratio is 1:4. 1 is male, female is 4 ratio. So women has more chance to get myxedema coma. Key features of myxedema coma include hypothermia, temperature may go below 95 degrees Fahrenheit. Mental confusion or lethargy, patient may experience altered mental status. Inappropriate humor. Confusion, it is called myxedema with confusion, psychosis, or even coma. Respiratory failure, breathing may become shallow, and in severe cases, respiratory failure can occur. Cardiovascular collapse, this can manifest as low blood pressure, both systolic and diastolic, and a slowed heart rate, we call it bradycardia. Fluid retention and edema, myxedema refers to the swelling of the skin and soft tissues which can give a puffy appearance. Dry skin, muscle cramp, fatigue, delayed reflex relaxation are features of myxedema coma. So what are the predisposing factors under which factor a hypothyroid patient falls into the trouble of myxedema coma, that is life-threatening condition? So predisposing factors are cerebrovascular accident. If the hypothyroid patient goes through CVA, anesthesia, or surgery, trauma, infection, or they are taking some drug like sedative, iodide, and amiodarone. History of radioactive iodine treatment are making a hypothyroid patient to more prone to develop myxedema coma. So these are the predisposing factors. What are the laboratory findings of myxedema coma? This is an emergency, but still we go through the laboratory finding. Thyroid function test, T4 thyroxine, T3 triiodothyronine, and thyroid stimulating hormone. Okay, these two will be low, this will be high usually. Blood and urine culture is also important. There may be some infection, there may be some UTI that may prone the person to develop myxedema coma from that of the hypothyroidism. Excuse me. Serum creatinine level is also checked. There may be some muscle damage in the body that may lead to myxedema coma. Imaging study, chest X-ray to identify pericardial effusion or pneumonia. In pericardial emotion, we may get widening of the mediastinum. There may be a bottle sign of the chest wall, and there may be consolidation of the lung in pneumonia. ECG finding, it shows bradycardia, heart rate goes less than 60, low voltage of QRS complex in all leads, flattening or inversion of the T waves. What are the treatment of myxedema coma? Myxedema coma is considered a medical emergency and requires prompt intervention. And mortality rate is very high. Without treatment, it may be 50 to 70% fatality rate. Even with treatment, there may be chance of 10 to 30% fatality rate. So this is a very serious condition. Treatment involves providing thyroid hormone replacement therapy, usually in the form of intravenous levothyroxine or in some cases triad with hydrogen. It should be intravenous, never orally at this time. This is an emergency. Supportive measures such as maintaining body temperature, we may use blanket over the body. Body is almost very cold, hypothermic, so we'll put the blanket. Fluid replacement, it may give several liters of fluid so that the cardiac output may be increased, correcting any electrolyte imbalance and providing respiratory and cardiovascular support are also essential. Corticosteroid, why will give corticosteroid? It is found that a lot of hypothyroid patient has also hypofunction of the adrenal cortex. So in case of myxedema edema, this is a myxedema coma, that is a severe form of hypothyroidism. In that condition, the steroid hormone may be very low, so it used to give corticosteroid. Broad-spectrum antibiotic, infection is a predisposing factor for myxedema coma to a patient with hypothyroidism, so we like to give broad-spectrum antibiotic. Prevention of myxedema coma, it is crucial for individuals with hypothyroidism to receive regular medical care. So person with hypothyroidism should take the replacement therapy like thyroxine, adhere to the prescribed thyroid hormone replacement therapy to prevent progression to myxedema coma. If someone with hypothyroidism starts experiencing symptoms such as extreme fatigue, confusion, difficulty breathing, they should seek medical attention immediately without any delay. Prevention is the key, and routine monitoring of thyroid function and proper management of the hypothyroidism can help avoid the development of myxedema coma. So hypothyroid patients should go through monitoring periodically, should have the lab test and proper management, okay, by giving the thyroxine, and certainly under a physician's the supervision can help avoid the development of myxedema coma. Okay, and that's all about the myxedema coma. I pick up this information from multiple resources for educational purpose. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.